Dr. Marcela, good afternoon, and thank you very much for being here with us today.
Good afternoon. Thank you so much for inviting me to be here today, Reda. I'm really
You are
happy.
most welcome, Doctor. Doctor, to start the conversation, can you please tell us who is Dr. Marcela and what do you do?
So first I'm a Brazilian doctor. I am living, I have been living in Dubai for almost 2 years now. I am an allergist, so I work in the field of allergy. And I'm also a pediatrician here in Dubai. I'm not working as a pediatrician, but my background, I am a pediatrician. Mainly, I work with allergies and I see kids and adults. I kid that I normally see people from 0 to 120. So I see all the ages.
Yeah. Doctor, just a question.
Mm-hmm.
Why allergist? Like, what driven you to this specialty?
So basically, because I wanted to help my mother. So I never wanted to become an allergist. I never wanted to become a doctor at the first place. I wanted to be a reporter. So I'm really happy to be here today. I like to talk with people. So that's something that I really enjoy of doing. But before I started med school, my cousin was diagnosed with lupus. And I said, this might be something that I might be interested in doing because I wanted to help her to achieve like a cure or a control of her disease. And then I decided to go to med school. And throughout the med school, I said, I'm going to be an oncologist. And then at the last year, I decided to change and do pediatrics. And then while I was doing pediatrics, I was kind of confused because I didn't have the specialty of allergy. And when I started doing it, because of my mother, that she suffers a lot with allergies, and I also wanted to help her, I fell in love with the specialty and I really like doing it and helping people. And I think when you are an allergist, you are able to see the whole family, normally allergies comes through genetics. So I'm going to see first the daughter or the son, and then I'm going to start seeing the father and the mother, sometimes the grandfather or the grandmother. So I follow the whole family. So I think that's why I like so much being an allergist, because I like to know people and help the families.
That is very fascinating, actually.
Thank
Doctor,
you.
to start the conversation, can you please let me know, like, what did your mother go through? What did she had? Because as you mentioned, that it's like an interesting part in your life, which made you go through this path. So can you please tell us?
My mother, when I was around 7 years old, my mother took an antibiotic, and right after she took it, she developed a severe allergic reaction and anaphylaxis. Back then, I couldn't understand what was happening. It was really shocking for me to see her suffering with that condition. She got completely transformed by the disease. My mother was super skinny and she had like hives on her body. She had swollen lips. Her eyes were super swollen. She looked like a monster, and she almost died that day. So I got really scared, and she has severe allergies to a lot of medications. And I said, maybe me being an allergist, I'm going to be able to help her not to develop these allergies anymore. And yeah, since I started in the field, I was able to control her, and she never had any events like that before. Again, sorry.
Speaking of antibiotics,
Mm-hmm.
how do they affect our bodies? Because I usually hear like two spectrums of the conversation. Some people say that they are beneficial and we have to use them. Some people say that no, they have like a negative effects on our body. So can you please let us know?
You see, sometimes you're going to need to use an antibiotic because if a patient has an infection and she might be killed because of that infection through that bacteria, you know, I don't agree giving antibiotics like anytime when a patient has a viral infection because the antibiotic is not going to do anything and you're going to be killing your on good bacteria. So
Mm-hmm.
if the patient has the need of it, of course, we need to treat the disease because we need to save the patient's life. And if we don't interfere and if you don't treat the disease that it's happening with the patient, that the how can I say that the end of the condition is not going to be good.
Mm-hmm.
Of course, when you give antibiotics, you need to think that you're killing the bad bacteria and the good ones. So we need to replace the good ones that has been killed. Normally, when I prescribe antibiotics in my practice, I am always going to give a probiotic to replace those good bacteria that I'm killing.
Mm-hmm.
So I think that's it.
Can we develop like immunity against some type of antibiotics? Or in other words, I usually hear that sometimes some type of antibiotics might not work for us every time. Is that true?
Mm-hmm. Yes, it is true. You can develop resistance to that
Uh-huh.
antibiotic. You know, if you, for example, I fell a sore throat and I was able to buy antibiotic and I took it by my own. I didn't go to a
Mm-hmm.
doctor. I didn't even know if that sore throat was caused by a bacteria or not. And on the second day, I started feeling better and I stopped taking the antibiotic. Then you're only making the bacteria more resistant. And on the next time, if you develop an infection from a bacteria and you're going to take the same antibiotic, it might not be helping you anymore because the bacteria might be resistant to that type of antibiotic. So
Interesting.
that's basically
Interesting.
it. Yes, resistance happens. It's not an immunity, but it's resistance. Yes.
Resistant. I see. Thank you for correcting me, doctor.
No?
One more thing. Now let's talk about immunology.
Mm-hmm.
So let's start with the basics. How can you introduce it to someone who has like no background about it? What should I, for example, as a regular
Mm-hmm.
person, know about my immune system?
See, the immune system is super complex. We have our cells trying to defend ourselves from pathogens daily, from outside, like viruses, bacteria, fungus, and also inside we have cancer happening every day. So our immune system needs to fight to help us achieve control of anything that it might encounter.
Hmm?
Nowadays, we know because of pollution, change of way of living, a lot of people has been living in major cities and not in the rural parts of the countries and so on. We are having a more modern way of life. And our
Mm-hmm.
immune system in my field, okay, in allergy, starts understanding things that are normal. So, for example, a type of food, or even a dust mite, or a pet dander, or an antibiotic or a medication, as being something like a threat.
Mm-hmm.
So, we start developing antibodies like the IgE and sometimes lymphocytes against those things that are used to our day to day life. And then we start having allergic diseases. So this is allergy. Of course, we have people that are born with deficiencies and genetic malformations, and they have like immunodeficiencies. So
Mm-hmm.
immunodeficiencies is when I don't have the quantity or quality of my immune system to defend myself from infections. So I'm going
Oh,
to have recurrent infections. So this is a secondary, a primary type of immunodeficiency.
mhm.
And we have also our immune system working against us doing rheumatological conditions. So we are going to fight against ourselves. So autoimmune diseases, it's the immune system working against our own cells and organs. So that's what I can
Fascinating.
explain about the immune system.
Fascinating, actually. Doctor, let's start talking first about the rheumatology. Like,
Mhm.
in what case do the body start attacking itself? And why does it do that, for example? How can we
Uh,
care
so
for that aspect?
So this is not so much my field,
Mhm.
but I can, like a doctor, I can talk about autoimmune
Please.
diseases. So yeah, we cannot understand why and how we start developing these diseases. We know that we have genetics, and of course, our DNA, it's only going to start expressing itself after some interference. So, I don't know, a major stress, an infection, a disease.
Mhm.
Sometimes things from outside are going to make our immune system cells going against our own. So we have
Mhm.
several types of autoimmune diseases like lupus or rheumatoid arthritis and so on. And that's your body working against yourself, basically.
I see.
But we still have to figure out a lot of questions, like in allergy, for example. Why do I become allergic to a type of food? We don't know. We know that
Mhm.
one day you're going to become allergic to something. Allergic diseases are unpredictable. We cannot predict them.
Mhm.
So, why we are creating this, we still don't have the answer, but we know that these things are happening and how can we manage? That's what we try to do.
So, could someone, for example, develop an allergy for a certain thing later in their life, or do they develop it since childhood?
So, this is a really good question. We can develop allergies in any point of our lives. So, being
Oh,
a child, a baby, or even young children, or a young adult, or even an adult, or an old people. That's why I said that I see from 0 to 120, because we can see allergies happening in any point of our lives. In terms of respiratory allergies, we see in any age. Uh, Food allergy also any age. One thing that I wanted to try to talk with you, because this is a really common question that I see in the office, and people normally think that allergic diseases come like when I'm being exposed to the first time to something.
mhm.
So it's the different thing from my diet. It was the different thing from my routine, and that's completely the opposite around. It comes after exposition. So normally, when you are going to become allergic to a type of food, for example, shrimp, you must have eaten shrimp one time in your life before.
Mhm.
It is rare. Sometimes it happens in first expositions, but you need to have a viral infection for you to be having an allergic reaction.
Mhm.
But this is more rare. Normally, you eat shrimp, and one day your body looks at the shrimp and say, "Don't like you anymore." When
Mhm.
this happens, you start creating IgE, that is the antibody that normally is linked to allergy, against the protein of the muscle of the shrimp. And In this point, you don't develop any reaction, but when you eat the shrimp back again, then you're going to start reacting. So
Hmm.
differently than normal people think, allergic diseases, so for food or even to a medication, it's not going to come on the first exposition to that. It's going to be after some time.
Interesting. Very
Mm-hmm.
interesting, actually. I never knew that. Like, I thought, like, if someone, for example, has an allergy for something, whenever they eat it for the first time, that would be it.
No.
Fascinating.
Normally, it's the opposite.
Yeah.
That's why it's important for us to have these talks, because
Yes.
normally I talk this throughout an appointment. And I think this is a really common question. And even for me, before I became an allergist, I never knew about it. I also thought
Mhm.
like you. But no,
Yeah.
after you start studying a little bit more, it makes much more sense to be like how I'm explaining to you
Mhm.
than to be the first time.
Very beautiful. Doctor, is it true that, for example, if we expose ourselves as children to many type of foods, many type of things,
Mhm.
we might not develop as much allergy as someone who was not exposed to them, like
Yeah,
for example.
so nowadays, differently than old times, we know that the sooner we start with the exposition to the different types of food, the better is for us. So we have a window from 6 months when we start the food introduction to 1 year old to introduce the most quantity of proteins and food that we can, that we know that we are going to begin and create more tolerance than
Mhm.
allergy. After 1 year old, we know study shows nowadays that then the person is going to be at the same range of the normal population to develop an allergy. So for example, a child that has been exposed to peanuts
Mhm.
since really young is going to have less chance of having allergic disease or allergic to peanuts when she's older than a baby that was only exposed after 1 year old. In
Mhm.
the past, we used to do that, we used to introduce peanuts and fish after 2 years old. Nowadays, it's completely different. We have this window for tolerance to be built. So that's what we need to inform people. Expose your children to the most different
Mhm.
quantity of food that you can while they are really young, before never before the introduction. Okay, when they need to breastfeed, they need to breastfeed, but after when they start being exposed to food, yes, to 1 year old, give them everything that they can eat differently. That will be a protection. We know also from studies nowadays that if we moisturize babies since they're born, we are going to make the skin barrier really a really good uh, barrier. So
Mhm.
it's kind of not a good word for me to use, but yes, when we moisturize, we keep the barrier more working as a barrier, and we are going to have less exposition to food from the skin when the baby is too young, and they're going to have also less chances of developing food allergy. So that's
Beautiful.
also a good fact that we know nowadays.
Something crossed my mind now while you were talking about exposing people to more things and allergies. For
Mm-hmm.
example, let's say I have peanut allergy and you have peanut allergy.
Mm-hmm.
Would the reaction to the allergy in my body be different than yours? Or would it be the
It
same?
can. It can. For example, you might have had a mild reaction, so you could have had like an urticaria, and
Mhm.
I could have had like a severe allergic reaction, like anaphylaxis. But if you continue to expose yourself, even though accidentally, to peanuts, you have the same chances as me from having
Mm.
a severe allergic reaction. Okay, so when you are an allergic patient to peanuts and you know that, each exposition to the peanut might give you an allergic condition. So, for
Mm-hmm.
example, you might have only swollen eyes at the first
Mm-hmm.
time, and on the second, you have anaphylaxis. Or on the
Mm.
first, you already have anaphylaxis. Or yeah, that's it. We can never predict how the reaction will be, but the more you're being exposed to the thing that you're allergic to, more chances you're having to have a severe allergic reaction like anaphylaxis.
Mm.
This we know.
Doctor, correct me if I'm mistaken, because I
Mm-hmm.
honestly like it fascinates me the fact that, for example, for two different people, we might have two different allergic reaction to our bodies. For example, I might have my throat closed, and you might
Mm-hmm.
have like some rash. Like for
Mm-hmm.
example, isn't in peanuts we are allergic for the same ingredient which is in the peanuts, and
Mm-hmm.
our bodies will react specifically to that ingredient.
To that.
So why
Mm-hmm.
would your body react differently than mine, for example?
Because it depends on each patient, it depends on
Mm,
each body, it depends on how much IgE you have for the peanuts,
I see.
but this is depends on each person. We cannot predict how the reaction will be. You're correct. Yes, it's the same molecule that you're going to be reacting. Some people are going to be, nowadays we know that they can be reacting to one type of molecule, other to other types. They might have IgE
Mhm,
that is higher for one part and other that is higher for other parts. Uh, One part might be more related to anaphylaxis and other part might be more to other symptoms, but that's basically it. Normally, when you're having food allergy, how the reaction might be. So you said a word that I normally hear a lot in the during the consultations, rashes. But
mm,
rashes can be so many things, And normally, when you are having an allergic reaction to a type of food, you're going to have urticaria. That is a hive, okay? So it's a red bump it's going to be on your skin, and it's going to be super itchy, and it can show up in any part of your body. So, for example, you can have a hive and an urticaria over here on my hand, and after some minutes, it will show up here in my arm and sometimes in my abdomen. And there are some patients that might react all over their body. Okay.
mhm,
Normally, what we know from urticaria is that it can be like changing places. And you can also have the angioedema, that is the swollenness of the mucosa. So,
mm,
swollen lips, eyes, ears, tongue,
mhm,
like you said, the throat. And when I'm having anaphylaxis, is when I'm having two or more organs of my body with an allergic reaction. So, for example, I have the skin with the urticaria and the swollenness of the mucosas,
mm,
and I also have shortness of breath and wheezing. So I have two, the skin and the lungs. I can have the skin and a major diarrhea. I can have the
mm,
skin and I'm going to faint because I have the brains being committed by the reaction. Or I can have the skin and my BP will drop. So
mhm.
these normally are symptoms of anaphylaxis, a severe allergic reaction. That's basically it. One common, sorry to interrupt you, but
No,
one other
beautiful, not a
common
piece. I'm enjoying
question
this.
that I normally hear and I normally see a lot of patients come to me to see if they are allergic to a type of food, but they are having like they're feeling bloated, they are having nausea, they're feeling gassy, they're having diarrhea, and I normally explain to them all of those things that I told you regarding food allergy, and I say this is not food allergy. This might
Mm,
be an intolerance to lactose, or you can be celiac disease, or you can have other GI tract diseases, but this is not an allergic reaction to food. This is a
Mhm.
really common doubt. They normally people think they are allergic, but they're not.
Very fascinating, doctor. Thank you very much for this.
You're
Let's
welcome.
talk about, you mentioned that some people get born with autoimmune deficiency. Like, for example, their immune system might
Immunodeficiency.
not be,
Yes.
yes, immunodeficiency.
Mm-hmm.
How can they work on improving their immune system? Or is it like a game over for them?
Yeah, no, good question. Uh, if they were born with this genetic alteration, they are never going to be able to improve their immune system. There's one type of immunodeficiency that it happens when the child is really young, and after when they are like 6 years old, is something that is transitory from childhood. So when they get 6, 7, they get better. But it's the only immunodeficiencies that we know that can be solved like this.
Mhm.
Normally, immunodeficiencies are chronic conditions that can only be treated by reposition of IgG, that is the antibody that is a memory that fights against the pathogens like bacteria and viruses. And others, they need to do a transplant of the bone marrow. So most of the patients will need to do like prophylaxis with antibiotics or something. But in these patients, there isn't any type of change of diet or any um, physical exercises that they can do to increase the immune system. Of course, that when you have a healthy way of life, this will
Mhm.
be amazing, for this kind of patient. For example, but one thing, normally you would think, eating salads and vegetables that are raw is good, right? But in this type of patients, they can have more parasite infections because you don't know how the salad was clean and
Mm.
how if there is
The
any
pesticides, for
contamination over
example, they're
there.
using.
Yeah, so in these patients we say, yeah, you need to eat vegetables and so on, but cooked. It's a
Mm.
different way of living.
I see. Very fascinating. Doctor, how can we strengthen our immune system? For example, I once read a book that is called Eat Dirt, and it talks about the idea how we should expose ourselves more to bacteria and nature, and so our immune system might get strengthened. How
Mhm.
can we strengthen our immune system, doctor?
Yeah, so in children, yes, we know we have this hygiene hypothesis that we know when they are being exposed to a more dirty way of living, but not dirty. They need to put their feet on the ground. They need
Yeah.
to play in the dirt. They need to be in places with pets and being exposed to those things. This will strengthen their immune system to defend them. We are going to have more antibodies to defend them than to even create allergies. This we know. But is there a formula for strengthening the immune system? This we don't. What we know is healthy way of life. So sleep well, eat
Mhm.
well, do physical exercises, drink water, don't drink too much alcohol, don't smoke. These are things that are going to be helpful for our immune system. So there's no magic, there's
Yeah.
no out of the box. There's nothing that will be like a miracle, like take this medication and your immune system will be in a boost. No,
Yeah.
there's not. If you do the basics, then yes, it will be good for you.
Very beautiful. Doctor, in the field of immunology,
Mhm.
like I'm pretty sure that we have developed via the development of technology from the past to the future now where we are. What can you tell me about what have we improved? Like how did technology help immunology to be better?
Uh, yes, technology can always be helpful, can be helpful for us to achieve better diagnosis. But sometimes we need to be a good doctor to know how to interpretate tests and even to deal with technology. So nowadays it's been like a fight from the major big societies of allergy and immunology to tell people that they don't need to be doing random tests, for example, to food allergy. Again, as I told you, this is something unpredictable, so we cannot predict. We cannot be doing tests randomly in a patient that doesn't have any symptom for allergy, for food allergy. So this is something that we need to fight. But we know, for example, with AI, this can be helpful for the patients, to achieve better
Mm.
control of their disease. So we have nowadays apps to know, for example, a patient that has severe atopic dermatitis, or a patient with chronic spontaneous urticaria, or a patient with severe asthma. We have scores nowadays that we can know if the patient is well controlled of their disease and if they're having an impairment on quality of life. And with technology, the patient can be filling up these forms for us, and it can be sent to us to our office for us to check if the patient is being well controlled with the treatment or not. And also to help us to see if the patient is doing the medications that we are asking them to do. So this is being helpful. And of course, we have a lot of things to get further on the future. We need
Mhm.
to, for example, understand why we developed this IgE and these lymphocytes against daily things and even ourselves. But we have really good technology to help us, but we need to know how to use technology well.
Very beautiful. Doctor, I want to talk about cancer cells. Now, from what I know, the T cells are
Mhm,
the cells which are usually work on defending our bodies from cancer. Am I
mhm.
correct?
Yes,
No.
a natural killer as well.
Yeah. So, as you mentioned that our bodies are always like, let's say, filtering the cancer cells in our body.
Mhm.
So why is it that sometimes we fail to filter them all and we develop cancer?
Yeah, this is also a hard question that we need to understand
Mm.
later on in future. But we know that cancers can come from so many things, for example, lung cancer. If you smoke, your cell is not going to be working properly enough, and you're
Mhm.
going to be doing cancers all the time, so your immune system probably might not be working well to protect you.
Mhm.
Also, for example, I'm dealing with a condition like I'm super stressed, burnout, depression. These things might make us more susceptible to diseases,
Mm.
so our immune system might not work so well. um, and of course, if we drink a lot of alcohol, all the excesses,
Yes.
might make us have the cancer, and sometimes the immune system might not be able to catch it. We cannot understand why this happened, but we know
Mm.
these things, these not healthy habits and conditions that we live daily can lead to diseases, unfortunately, to chronic diseases.
Very fascinating. Like, I love the fact that we still have questions to answer. Like, until
Yes,
now, we are always trying to like find the answer. Like, it's a never-ending journey, I think, because like the
yes,
more we go through time, the more questions come. Actually.
yes. The more we know about our body, like for example, genomics, the DNA, the more we learn, each day more things, and
Yeah.
new diseases come, and like COVID, COVID
Yeah.
came to break barriers. I never saw a virus like this in my life doing medicine for a long time. So yeah, we are learning constantly, and I think for people that might want to become doctors, this is something that they need to have in mind. For you to be a doctor, you need to be in constant learning. We are always studying because there are always new things. Just for you to know, this thing that I told you before about the food allergy and tolerance in infants that we need to give the sooner the better. When I was doing my residency, it was completely different. I learned something,
Hmm.
and now I'm saying different things.
Yeah.
So consensus change, new technologies arrive. So yes, we are in constant learning.
Doctor, why was COVID special in a sense? Like, what was special about COVID than other type
Yeah,
of diseases?
yeah, it's a virus that doesn't work like normal viruses. For example, after we have an infection, we're going to develop memory against that
Hmm.
infection, against that virus, or against that bacteria. COVID doesn't work like this. We know that we
Really?
have it's a short memory time. That's why
Mm.
we need a vaccination. It went so deep down in level. So in my field, we had patients that were well controlled of rhinitis, asthma, even chronic urticaria. They were well, and after the infection, they relapsed. They were
Mm.
super uncontrolled, you know? So it's a virus that is really completely different than anything else that we had seen before and we learned in
Actually,
school.
what you just mentioned is very true because young people and adults, like the different categories of people had like different reactions. For
Mm-hmm,
example, they used to say at the beginning that it doesn't affect young people as much. However, it was for some people. And they
mm-hmm,
used to say that it doesn't it affects the elderly heavily. And some
mm-hmm.
elderly were not being affected with it as much. So, like, we didn't understand a lot of things about it.
Mm-hmm, mm-hmm. Yeah, we still have to learn a lot of things, and it gives late symptoms. So yeah, the loss of smell that stays for a long
Mm.
period of time in some patients, and others no. Some are asymptomatic, and others have severe disease, and they die. So it's a really different virus, and we really need to learn more about it after time, even though it has been already 4 years that we start with the beginning of the pandemic. We still have a lot to learn, and we are seeing a lot uh, of patients having other diseases after the infection, and we are learning each day more and more.
Very interesting. Very interesting, actually. Doctor,
Yeah.
what are we lacking now in the field of immunology? Like, for example, what should we work more on to enhance this field? From research, let's say, what are we missing?
Yeah, we are missing to understand why we develop these cells and antibodies against normal things. This is a major question for me. Why do we do that? We know that this is something genetic, that it depends on other expositions to start activating this DNA. This we understand, but
Mm.
why do we create that? Yeah, we needed to understand. And in the field of immunology, we are achieving really nice results with editing of the DNA. So this is a future, it's something for the future. I think it's going to be really well to know. And if we can edit our DNA to control this DNA that has allergy written down, over there,
Hmm.
This will be the cure of allergy. I always tell my patients that unfortunately, when you are an allergic patient, we don't have a cure. We have a control of the disease. And they get well controlled for a long period of time. I'm saying this more to respiratory allergies, okay, like rhinitis, asthma. And if we can edit that part of the DNA and try to turn off the switch, would be amazing. So I think that's the future, for us to try to control and cure the patients.
Very beautiful. Doctor, thank you very much for your insight. Thank you very much for what you presented with us today.
You're
If
welcome.
there's anything that you would like to share from your experience with the audience about, let's say, tips from your experience of how to better care for ourselves, please, the floor is yours before we close up the episode.
So I think if you are an allergic patient, the most important thing is for you to understand that your symptoms can get better controlled. Most of the patients come to try to seek help only when they are poor of symptoms. They are having a lot of symptoms, so you shouldn't be suffering so much. You can try to find an allergist to help you to control your symptoms. And those symptoms might be runny nose, itchy nose, nasal congestion, shortness of breath, wheezing. If you have urticaria, chronic urticaria, we can also help you to achieve control of your chronic disease. If you have atopic dermatitis, of course, we can try to help you in the itchiness of your skin, and we can try to make your life a little bit better. So what I can say to the patients is, first, if you don't know if what you have is allergy or not, try to find an allergist to see if what you have is an allergy. And second, if you're suffering with your symptoms, try to seek help with a professional, because you can live better breathing through your nose, breathing through your lungs, not itching your skin. And that's basically it. You can have better
Thank
quality
you
of
very
life.
much. Thank you very much, Dr. Marcela. I very
You're
much appreciate
welcome.
your time and information and wish
Thank
you
you
all the
very
best
much.
and all the happiness.
Thank
Thank
you
you very
very
much.
much. I really enjoyed working to be here with you and to be working with these patients. And thank you for allowing me to talk a little bit about my specialty that I'm passionate about.
My pleasure, doctor. You are always welcome, and whenever you want, I'm available.
Thank you. Thank you. Have a
Thank you,
great
doctor. Bye
week.
bye. Ciao.
Bye
You too.
bye. Ciao.